Systemic mastocytosis, or SM for short, is a rare health condition where you have too many mast cells, a type of white blood cell. For most people, SM is caused by a random change or a mutation in the gene that carries the instructions for the growth of mast cells. This gene mutation causes the signals that control mast cell growth to stay turned on, which results in too many mast cells being made. Mast cells are normally found in your bone marrow, where they're made, and throughout your body in your skin, lungs, and digestive system, as well as in other tissues and organs. Mast cells are part of your immune system and work to help it function properly so you can stay protected against certain diseases and infections. To help your immune system, once mast cells become activated, they release mediators, such as histamine. Mediators will then cause certain immune responses to happen, including inflammation or swelling. But when you're living with SM, the extra mast cells being made can build up in your tissues and organs. And extra mast cells mean more mediators, which means an increased immune response that can cause symptoms and additional problems or complications. SM and its symptoms can happen at any age, but the risk increases as you get older. Because of this, SM is typically diagnosed or found when someone is in their 40s or 50s. With SM, your symptoms will usually depend on the parts of your body where mast cells have built up. This can often be in your bones and bone marrow, as well as in your skin, liver, intestines, lungs, lymph nodes, spleen, and brain. Symptoms of SM can include hives, itching and flushing, stomach pain, nausea, diarrhea, and vomiting, a swollen liver, spleen or lymph nodes, bleeding problems and anemia, fatigue, headache, bone and muscle pain, mood changes, depression, anxiety, and problems with memory or concentration, and anaphylaxis. Excess mast cells and mediators can also cause complications such as ulcers and bleeding in your digestive tract, liver problems, bone problems such as osteopenia, osteoporosis, and fractures, neutropenia that can make it easier for you to get infections, organ damage and failure, and cancer. There are 5 main types of SM, and each can have differences in symptoms and complications. Indolent systemic mastocytosis, which is the most common, and often has less severe symptoms that can get worse gradually over time. Smoldering systemic mastocytosis that has more severe symptoms and can damage your organs over time. Systemic mastocytosis that happens along with another blood or bone marrow cancer and tends to be severe and develop quickly, often causing organ damage. Aggressive systemic mastocytosis, which is rare and develops quickly, causing severe symptoms and organ damage. And mast cell leukemia, or MCL, which is extremely rare and aggressive. MCL grows quickly and causes a large number of mast cells to build up in your bone marrow and blood. SM symptoms can be different for different people. They can also sometimes be similar to or overlap with the symptoms of other health conditions. Because of this, being diagnosed with SM can often be delayed. So if you have any questions or are wondering if you may have symptoms, talking to your healthcare team can help you learn more and get you on the path to diagnosis and care.